Good afternoon. First, I want to begin by recognizing, again, incredible people we see every day. The people working on the front lines are our clinicians, our caregivers, our physicians, our nurses, our advanced practitioners, who are absolutely doing amazing work, adjusting and managing to this crisis. Just today, in fact, I received several letters from several of our nurses, and they were talking about an interesting dynamic, because at one level, they're scared, and they acknowledge the uncertainty, the ambiguity of the circumstances they're working with. On the other level, they're describing that they feel safe, protected, and that they are absolutely committed under all circumstances to taking care of the people we're entrusted to care for. And it just makes it so real when you see their words, and we understand that we're putting tremendous stress on our operations to respond to what truly is an unprecedented set of circumstances at a moment in time. As such, we continue to evolve. Our command center is meeting routinely, and we're bringing together our leadership who are continuing to adjust to the changing fact patterns as we go forward and as we learn more. And we continue to make new decisions and make adjustments. So today we're going to speak about two specific areas. One is continued refinement to our visitor policy. It's some further restrictions we're putting in place as we manage the safety and security of our campuses for our patients and our staff. And in addition, we're going to speak to activating additional support through our behavioral health network. And there's clearly, and we see it in our command center, and it's very evident based on the thousands of phone calls we're receiving, there's heightened anxiety both within the community and within all aspects of people who are affected by these circumstances. And we have a behavioral health network that stands ready to be responsive and can provide a tremendous service today. And you'll learn more about the strategies that we're putting in place to make it even more accessible and more apparent to the community. So let me first introduce our Chief Clinical Services Officer, Dr. Ajay Kumar, who will speak specifically on some of the work we're doing today in communicating aspects of our visitor policy here within Hartford HealthCare.
Thank you, Jim. Thank you very much. My name is Ajay Kumar. So as we've been talking about our evolution of our preparedness and how we are getting a system ready for this emptying, I want to remind all of us to Hartford HealthCare and our healthcare system across the state of Connecticut is ready. And I want to make sure that people actually take it calmly and as much as possible be educated and aware of what is going on in our country and our state at this time. I think a lot of decisions being made are proactive decisions to prevent more people getting sick. We continue to change our process, we continue to evolve, and I like to believe that we are staying ahead of the curve to a certain extent in many of the areas. I think we've led in multiple different ways of putting the policies together, putting the safety of our colleagues and our individuals who are working in healthcare institution to protect them. So yesterday we talked about the visitor policy, and what we've done is effectively limited only one visitation, one individual to visit a patient at any given time. And this is to protect our community, and it's also protect our colleagues. I had a chance to visit some of the areas where this has been managed, and it's been done very well. Actually, we had several patients and family members who thanked us for doing that, because that is the right thing to do, and they understand what we're dealing with at this time. But at the same time, compassion is a core principle here. We're looking at the individual cases, the individuals who may have a very sick family member who's about to take a turn for the worse, or have a father whose wife just delivered a baby. We're allowing multiple individuals to come in those circumstances, case by case, and with living with the principles of compassion. As Hartford HealthCare evolves, as the situation evolves, we're going to continue to stay ahead of the curve at this time. And you will hear over the time the innovative things and new things we'll be doing in Hartford HealthCare to make sure our community is safe at this time. With that, to address some of the concerns of anxiety and concerns we have in the community, I'm pleased to introduce Pat Reamer. Patricia Reamer is the president of Behavioral Health Network, and she'll address some of those areas. Thank you.
Good afternoon. So as we think about the anxiety that people are clearly experiencing and fear, frankly, I think it's really incumbent on us to try and make sure that we're communicating facts to the community, that we are really communicating about what we can do and we're continuing to take care of our patients. So for example, in the Behavioral Health Network, we have partial hospital programs, intensive outpatient programs. We will keep those programs up and running because people need to receive the care. Obviously, that's a decision that we will continue to evaluate, but we really believe that we need to be able to address people who have behavioral health disorders as well as dealing with some of the community issues. So for example, earlier today, many of us have heard about school closings, right? They're kind of rolling. We keep hearing different schools are closing. That creates difficulty if you have a single parent that doesn't have a daycare, if you have parents who split care. It's very difficult. And so how can the communities come together to work on some of these issues? So are we going to have parents that perhaps do stay home, that would be willing to take care of other children? We know that children are not hugely impacted by this right now, so it's probably safe to have kids together, but not at a school where there's people in and out and teachers. And so we understand the school system's rationale, but we want to encourage parents to think outside the box, because we do know that young children who are in good medical condition are not being impacted by this as heavily as our older adults. So we're being thoughtful about how we treat our older adults. We need to be thoughtful about how we meet the needs of the families in our communities. I think having an open phone line like Hartford HealthCare does has been incredibly valuable because people have questions. And one of the things I think we're all experiencing is that every hour something is changing. So we have to be very agile, and we have to be ready to meet people where they're at. So I think with that, I'll introduce Colleen Mulcairn, who's going to talk about our staff.
So as Pat's talking about the way anxiety is impacting everyone, it impacts us as our healthcare workers as well. And what we really pride ourselves on is continuing our work business as usual. So even though the approach is a little bit different and the visiting pattern is a little different, we want care to continue, and we want everyone to feel like they're the only patient that matters to us. And so we have a really big focus on managing care and making sure that every birth, every admission, every discharge is well coordinated and well organized. And so we do that by taking care of each other. We make sure that our patients and families are feeling heard and listened to and supported. But we also have time to debrief and process what's going on in our own lives. And so our social workers, our chaplains, folks here really do take time to kind of turn to the other person and say, so how are you doing? How has this been for you? What are you worried about? Folks have had to cancel trips and cruises and vacations, and it's really impacting people. So planned fun time and leisure time has really changed. So we talk a lot about workplace wellness. We talk a lot about what we can do to organize ourselves and organize and pre-plan to diminish our stress and diminish the things that we can control. There's a lot of things that are outside of our control, and that's really the hard part right now. So we have to think about the things that we can control. So thinking about pre-planning and organizing, having time to take a breath, get some fresh air, go for a walk, exercise, time for some meditation or journaling. Those are all the things that really help us in that process. So we really carry on and really have a chance to make sure that every patient is feeling well cared for here and that the staff are feeling supported. Thank you.
And now we're going to introduce Dr. Stephanie Wright with a COVID-19 update. She is our Assistant Director of Infectious Disease.
Are there specific questions that people have regarding COVID here?
She's our infectious disease expert, so then.
With one of our new cases being with a child, from what we understand, why are we not seeing more severe symptoms in younger children than we are older adults?
Yeah, I don't think the reason for that is known, but it is true that symptoms are not as severe in children, and we don't know how many children are getting the disease relative to adults. I mean, it appears to be more of an issue in the adult population.
Can you talk a little bit about this concept of flattening the curve with all of the closings? People are thinking, there are a lot of folks who think this is overreacting. Can you talk about why it's not an overreaction?
Sure. The reason it's not an overreaction, I mean, I could see why people might think that. We're saying that 80% of people or more who become ill with this disease will recover without even having to be in the hospital environment. However, there are vulnerable populations, and those include those persons who are older and persons who have underlying conditions such as diabetes, heart disease, lung disease, cancer, and so forth. And for us to be able to continue, meaning healthcare systems across the United States, to be able to continue caring for the people who come in with regular problems, who need inpatient procedures and care, and to be able to care for those who have underlying conditions or who are older. We need to be able to have as many people in the workforce available, and we need to be able to have persons as healthy as possible, and we need to avoid spread in the community such that it ends up causing spread to people who are in vulnerable populations, and we have many people at one time seeking care in limited numbers of healthcare facilities, acute healthcare facilities, with only so many workers available. So we want to bring down the number of people that are presenting with the severe manifestations that require hospitalization, so we have the healthcare workforce to care for those patients and also to care for the other patients that we need to care for on an ongoing daily basis in the hospital.
With testing not widely being available, I think there's a lot of people who may be thinking they have symptoms, who may think they have this coronavirus, and they just don't know it for sure. So they're at home, self-monitoring, self-isolating. What should they be doing at this time? Like, what's the treatment that you're recommending?
Well, I think if you're concerned, you should call your healthcare provider, or you can call our hotline to speak with someone, which is, I believe the number is 860-972-8100, and discuss your symptoms with the healthcare provider that you have, and a decision can be made as to whether you're a person who might be at risk but is well enough, like most people are who get this disease, to be at home, or someone who has got a more severe presentation, may have COVID-19, may have another condition such as influenza or a bacterial pneumonia, and would need to come to the hospital. The goal of having contact occur before you walk into an emergency room is to, if you are at high risk, be able to get you into isolation so that testing and care can occur for you, and the healthcare workers can be protected that will be caring for you and other patients, and to avoid having the emergency rooms get large numbers of patients for whom there's really no emergent care necessary, who will keep us from taking care of all persons who have emergent issues and need to be taken care of in the emergency room.
So, Dr. Wright, now that we've seen a communal case, can someone be a carrier only of COVID-19 and spread it and never exhibit symptoms?
Well, we do have some information that we have from some articles that have been published, that there may be people who are asymptomatic and transmit the disease. It is, what we do know though from the experience in China is that it's very, very clear that people who are symptomatic are ones who spread the disease. And so it's very important, if you're symptomatic and you're coughing or you're sneezing, that you put social distance between yourself and other people, that you stay home to avoid spread. The asymptomatic carrier we don't know as much about, but I think the most important thing to know is that if you are symptomatic and you have disease, you are capable of spreading it to people who are within 6 feet of you, and that's why you need to follow respiratory etiquette, hand hygiene, and stay home.
The state epidemiologist is saying that like 70% of the community is expected to get COVID-19. I mean, 70% of the community, you're talking 20% would have a more severe case. I imagine that could be overwhelming to the hospital systems. We've seen it in other states. Is there any concern that this could really overwhelm the hospitals?
Well, again, this is why the strategies that are being employed are being employed. Closing schools and having people stay home that are ill, it will hopefully keep the number of people down that have the disease, will keep the community transmission down, so it will keep the number of people who are vulnerable for more severe disease down so that it doesn't overwhelm healthcare facilities, and the healthcare facility resources we have now are able to take care of the people who are sick and will require intensive care.
Can I add that to that?
Oh,
Thank you. So this is a great question. The hospital capacity, I can tell you that the entire state, and especially Hartford HealthCare, has been in the preparation mode for several weeks now. And we've looked into different types of scenarios. We looked into the capacity of different types of individuals who might come. And we've created a system at this time where we feel very comfortable of managing even extended capacity. So again, I want to reassure the community that we are ready here and we can take care of that. One of the new things we installed today, we actually made it happen, that we have a virtual patient management capacity installed in emergency rooms right now. And this allows our colleagues to be protected if somebody comes with a COVID-19, but does actually make us a bit more agile at this time here. So we have looked into different types of scenarios, like even extending our negative pressure rooms, isolation rooms, our critical care space, our any other capacity. And we are blessed to have such a large system to be able to do that in a larger scale as well.
We talked about hand washing, staying away from larger crowds, especially over 100 for those events. Is there any advice for people that you feel like is not being emphasized that you think is important to stress?
Well, I'm glad you asked this question. I think this is very important. Social distancing is a critical thing at this time. I can tell you what we're doing in Hartford HealthCare. We have actually, obviously, travel ban we instituted much earlier. We also created a policy of canceling all our meetings, which are larger than 10 people in gathering at this time. And we are converting all the meetings in virtual capabilities at the moment. I would advise the community at the moment, the hand hygiene, obviously alcohol-based rubs, cleaning your hands for 20 seconds, making sure you don't touch your face, creating a social distancing wherever it's possible. Try different methods of elbow tap or noting or whatever else you can do at this time to avoid the contact. A large crowd obviously is a place where you have a significant risk of exposing a large number of people, and the domino effect is that you can go and infect more people, and that's how the community spread begins and gets out of control.
Going to the mental aspect of what you're talking about right now, when it comes to our social influences being essentially changed dealing with this, how do we as a people try to cope with this new change in the way we even talk to one another?
I'm going to invite my colleague, Pat, if you want to address this. Sure.
I'm sorry, could you just repeat that one more time?
Just when it comes to our social interactions, shaking your hand, saying, hi, how are you? It's essentially changed for the worse in this case when dealing with COVID-19.
Right.
How do we even adjust our mindset to deal with this right now?
Well, it is a huge change, right? And so change is difficult for everyone. And I think that we have to constantly, my experience has been we have to constantly remind each other, and we have to be very supportive and really talk with people about the reason we're doing it, because we're all used to just shaking people's hands, but we really want to discourage that at this point. We really want to encourage people to wash their hands probably 3 times as much as they were a couple weeks ago. That's a big change, and so it needs constant reminders, and people need a lot of support from their families and from the community to help us all remember this. One of the biggest things is reminding each other, I think, to do some of these things.
And as far as parents talking to children about it, I know that they're not as impacted by this virus, but they're probably hearing a lot, maybe at school before school's closed,
Right.
hearing it from parents. How would you recommend that they talk to their kids?
So it depends on the age of the child, obviously, but kids under the age of about 10 are very concrete. So giving them facts, but not overwhelming them with facts. So yes, people are getting ill. Perhaps there are some people dying. Kids are watching the news. They know about this. We need to really talk with them about their risk factors, about their grandmother's risk factor, about their parents' risk factor. Parents that are coming into work at hospitals, their kids are reacting to that. It's very important, though, that we're honest about it and that we tell the kids the facts. Once they're beyond about 12, you can have a little bit more in-depth discussion with them. But again, depending on the child, because some adolescents who are going through difficult adolescence, they're anxious enough. Adding this to that right now is going to be difficult. So I think, again, we have to be a little bit concrete, factual, and not panic ourselves. If parents are panicking or overly anxious, they're going to transmit that to their kids. I've actually been encouraging some of our staff to turn the TV off when the kids are in the room, because while we're all really anxious to get the information we need, it's like any other disaster or any other incident like this. Too much information overloads the kids.
And even speaking about anxious parents, when it comes to those who have to now decide whether to stay home with the children or go to work, what do we tell them right now, just dealing with their own mental stress at this point?
Right. I think it's really important that people make their own decisions as much as possible, because again, as I think Colleen said, people are feeling really out of control. So where can we give parents control? Can parents stay home from work? I mean, that's going to be a big question. We have certainly single parents that work here that are going to have to figure out what to do. But again, if the parents' anxiety is really going up, so will the kids. And so making your own decision, making a decision that you're comfortable with is really the most important thing.
And what should be the level of concern for people right now? Because I think it's kind of an extreme for a lot of people. Either people are not concerned at all, or they are panicking and hoarding toilet paper.
Yeah.
You know, like where should people be right now?
Yes.
It's a great question. I would say that people should be cautious, people should be educated, and should be aware. And I think asking the right questions at this time is a very important thing. And I advise folks actually who are looking for some help and guidance at this time, I'd like you to come to our website. I'd like you to call the call center and get some help here. This is the time to not take it lightly, I would say that. This is not to call it a hype. It is a real issue we're dealing with right now. But I do want to assure our community and our people that our system is ready and we are going to be able to take care of them. And as things spread, as things change, we're going to respond accordingly as well. I think with that, I'm going to introduce again Mr. Flax.
I want to close just by, again, recognizing all of our colleagues, all of the people working in Hartford HealthCare. I'm incredibly inspired by what I see each and every day. I know our team will rise to the occasion. They always do. They have time and time again. It's why we're here. It's our mission. It's our purpose. And it's why people join an organization like this. We are here for our community, and we will be the safety net. And we are clearly going to do whatever we possibly can to support the community under whatever circumstances we encounter. There are three principles we're working off of within our system. First is we're going to communicate, and we're going to communicate broadly. Secondly, we're going to be accessible, which is why we're having press conferences like this, why we established our website, our command center, and why we're doing our now forced push texts. And third, we're going to be completely transparent. So you should expect that of us as we go forward. That's the leadership that we will play within this process. And it's an essential role within the community. While there is anxiety, while there is uncertainty, and while there's a changing fact pattern day to day, we at Hartford HealthCare, and most importantly, the 30,000 people who work here, we will stand strong to do the work that needs to be done. And we're making preparations. Our team is working on a 24-hour, 7-day-a-week basis right now to respond to the issues at hand. So thank you.